So liver cancer, technically known as hepatocellular carcinoma, is a commonly seen cancer that very frequently happens in people who have cirrhosis of liver for many different reasons. It's a response of the liver to injury, and this ongoing injury and response to that injury gives rise to this kind of cancer. The treatment of hepatocellular cancer is difficult. If the patient is lucky enough to be diagnosed early when the cancer is small, then surgery can be curative. However, that is not the common situation. More commonly, by the time the patient is diagnosed, the patient already has advanced cirrhosis and surgery is not a practical option. What remains is treatment either by interventional radiological techniques or by chemotherapy. Unfortunately, chemotherapy of liver cancer at this point of time is not very promising and has not led to very great research. So how does interventional radiology help in cancer? The peculiar thing about the liver is that it has two different supplies of blood. One blood supply, like every other organ, is what it gets from the heart directly from the arteries. That is called the hepatic artery, and that blood supply is called the arterial supply. The other blood supply comes from the entire stretch of bowel or intestines that are housed in the abdomen. And this is because the liver is the chemical factory of the body. Every bit of food that gets absorbed from the intestines comes to the liver and is then processed for use by the rest of the body for a multitude of functions. This supply is called the portal venous supply. Very peculiarly, hepatocellular carcinomas are supplied solely by the arteries. As a result, a very special treatment is possible in which the arterial supply to the tumor is accessed by using catheters and microcatheters, very tiny small tubes coming through the arteries, and then we inject chemotherapeutic agents and we block the blood supply of the tumor. This kills the tumor cells because of the very high concentration of chemotherapy agents that we can give directly from the arteries and by blockage of the blood supply. This is known as transarterial chemoembolization, and this is a combination of taking away the blood supply or nutrition of the tumor and applying chemotherapy to the tumor. This is not the only technique that can be used for treating tumors through arteries. The other kind of therapy, which is a more recent development, is known as radioembolization. In this, very tiny particles which are radioactive, and most commonly that radioactive agent is called yttrium-90, that is injected similarly through the arteries to give a very high dose of radiation to the tumor without affecting the rest of the liver or the other parts of the body, and this allows us to treat the liver cancer with radiation at a very high dose, which can at times cure the cancer. Apart from this, there is one more group of treatments that interventional radiology can apply to these cancers, and this is particularly effective when the cancers are small, between 3 centimeters to 5 centimeters in diameter, and these are techniques of ablation. Ablation is a term that is used when we use a specific kind of probe or needle to raise the temperature of the tumor enough that the tumor cells are killed. This can be done by using microwaves like you use in your microwave oven, or it can be done by using a varying electrical current that's called radiofrequency ablation. All these techniques put together allow us to treat a large number of patients with liver cancer who are not amenable to surgery. And this makes us very commonly the only source of solace and treatment to these patients. So if you have liver cancer, please consult an interventional radiologist, because you might have a treatment that will be really beneficial to you without putting you at high risk or sending you for multiple days of hospital admission.